Hi, my name is Dr. Rudramon, and through the Oral Health channel today we're going to be talking about a very important topic: what to do in case you have lost all your teeth. Do we go for implant supported dentures or conventional dentures? Let's start. So this is a very important topic that I would want to talk about, implant supported dentures versus conventional dentures. So I went down to the articles in the books, and everywhere I could see that the oral health related quality of life of patients in patient questionnaires and satisfaction surveys, the patients who had undergone implant supported over dentures or implant supported dentures were much more satisfied with the conventional dentures. Now I'm going to state the reasons why. The first and foremost thing that I have to tell you is that the alveolar ridge undergoes resorption once you lose teeth, and the WHO has already stated that edentulosum, that is the absence of teeth, is now considered as a handicap. Now what I would want to really talk about is that the alveolar ridge undergoes resorption. That means it withers away once you lose teeth. If you place dental implants in that area, the area remains intact. The residual ridge might resorb, but it will not resorb to the extent of a complete denture. The second most important thing is that the chewing efficiency goes down considerably if you take complete dentures that are removable dentures versus implant supported dentures. Now obviously, for obvious reasons, natural dentition bite force, the maximal bite force, is actually the best, followed by implant supported over dentures, and then followed by complete dentures. A lot of people might argue not just the finances but about their medical conditions. Until and unless you have absolutely uncontrolled diabetes, it is not a contraindication for implant therapy, especially around corticocompressive and basal implants, where the implants do not engage in the alveolar bone, they engage in the basal bone or the cortical bone, which is not affected by modifying factors such as diabetes and other diseases. Now, it is understandable if you are a medically unfit person, you've had a stent operation or a bypass surgery, and you cannot be weaned off for some time for any sort of blood antiplatelet medications or blood thinners. That is understandable. Then we might have to go for conventional dentures, but otherwise, in all entirety, it has been found that compared to conventional dentures, the implant supported dentures are much better, much patient satisfaction, speech wise. Psychologically, it brings a better impact because you don't feel old. That is the most important thing, because the moment you lose your teeth, you start feeling this social isolation and this kind of harrowing psychological embarrassment that you have lost your teeth and you are now wearing a removable set. Please try to understand that this is something very important, not just the chewing efficiency, how you smile, how your face comes out, your muscular support. Because when you wear conventional dentures, your muscular support goes down, your vertical dimension goes down, and it is very palpable until unless the prosthodontist who fabricated the denture has done a very good job. It's very difficult to actually not be able to decipher that this dentition is natural or not. However, with implant supported therapy, you will not have this kind of problems. Of course, medically you have to be fit, and we'll have to take a clearance if you are not from the medical facility, so that we can go ahead, and if you're not a contraindication for implant supported therapy and the implant surgeries. A lot of people are actually very scared of implant surgeries, but they are actually minor OPD procedures done under local anesthesia, where you can be very painless. It's very painless. You don't get any pain, maybe a little pain, that the same amount of pain that you might get after tooth extraction, or even less. So you have to really understand what kind of things we are offering at the table when it comes to implant supported dentures compared to conventional dentures. Understandable, and it's completely agreeable that if the finances are not in your favor, you might have to go for conventional dentures. But the problem that comes with complete dentures over a period of time is they start rocking. Secondly, what happens is that the chewing efficiency is so low. Because of that, you don't chew your food properly, so you start going for starchy food, which is very easy to mashable food, that is easy to eat, and you will not chew the food properly, and you'll end up having problems like IBS and constipation and other digestive system issues, which I feel in the long run is going to hamper your your gut health. Is very much related to your mental health. And on top of that, if you are having selective malnutrition because of the fact that you're not able to chew your food properly, there's less amount of proteins and more amount of carbs in your diet, you might end up having bigger medical bills which might require hospitalization and all those things. Now I know this sounds like a very extrapolated figure, but that's what it is all about. If the finances are not a problem, if your medical compromise is not a problem, then I would strongly recommend at the drop of a hat, please get your implant supported dentures compared to conventional dentures. I have nothing personally against conventional dentures, but I've noticed it is a very harrowing experience. First of all, it's a lot of appointments. Secondly, you have to understand that it requires a lot of adjustment. It can cause you pain because it leads to some sort of denture sores as well, and there is a compliance factor that is required because of the fact that you have to keep the dentures overnight, you have to keep them clean and all those other things. So I feel that at the end of the day, you will take the call, but if you were my patient and if my family member had the same problems having edentialism, I would go for implant supported dentures. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients. Just drop me a message with your name, your location, and the common oral health problem that's giving you discomfort. If you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.